Bring Melissa from Island Cancer Center on. Good morning, Melissa.
Good morning.
So I know we're getting a lot of calls about cancer patients maybe going through chemo or with appointments, and how does this, lockdown, the shelter-in-place order that goes into effect at noon, how does this affect services that they get from you guys?
So for us, I can't speak for chemotherapy because that's medical oncology. We do radiation oncology. And for us, even for other patients, if they have any questions about whether or not they should be going to their appointments, they can always call into their clinics or speak to their healthcare providers. They'll give them that information. For us, radiation oncology works by succession. So you need to come and meet every one of those appointments in order to get the best outcome for your cancer. So our patients that will continue to come to the clinic even with the lockdown. What we've done is we've tried to limit the amount of traffic and the amount of people that they have to pass coming to our clinic. So we ask them to be delivered directly to our back door so they don't have to go through the common areas of the building that our clinic is inside. So they actually come directly into our clinic. We can measure their temperature when they come in. Patients that are new consults, we gather all the information prior to them coming. We make a pre-screening phone call to them to make sure that if they have any symptomatology that would put them as a person under investigation, then we would mask them when they come in because they still need to make their appointments. There are some cancers that just aren't going to wait for COVID-19 to be gone.
Yeah.
So how does this work? They call in advance, and then do they come in through the front or the back? Or
Yeah, so our clinic is actually inside the Guam Medical Plaza. So in most cases what happens is patients would park out front, come in through the front door, and by the way, the building is screening patients when they come in also. But we want to decrease the risk to our cancer patients even more than that. So instead of coming through that front door, we're asking for their family members, whoever's bringing them to their appointment. If they're driving themselves, fine. If not, then a family member. Drive directly to the basement. We have a basement with access to our clinic, and we're the first door. Our cancer patients know where we're at. It's the first big silver door that they would see coming into that basement is the back door to the Island Cancer Center, and we've got a big sign on the door as well. So they actually enter directly to our clinic and leave directly out of our clinic, which decreases their exposure to other people.
I see.
And how hard has it been for you guys to juggle having to treat these patients with following these directives that are coming out from the governor?
Actually, not too difficult for us. Most medical places are using really good hygiene in their clinics. The personnel are using good hygiene as well. Obviously, now there's a bigger risk for healthcare workers to be exposed to somebody who doesn't realize they've got COVID-19 virus and are shedding. So, you'll see people with masks on more now when you go into the clinics, which is a safeguard for those that are treating patients. We got to keep our healthcare workers healthy so that they can continue to treat. So they'll see that there's some of those differences. Obviously, that means we're using more supplies, and supplies are in short order. So we're being careful with what we're using things for, as well as with patients.
Are you having to change your hours or anything like that?
We are speeding up our day a little bit, not a lot, but yeah, we're condensing. We don't want more than 4 people in our clinic at any one time. We can easily keep people 6 feet or more away from each other. The clinic is fairly good sized, and even in our normal everyday routine, there's generally not more people than that. The biggest difference is reducing the amount of family members who are here. So normally, we don't mind having as many family members as that patient is comfortable having. We want our patients to feel supported. Right now, that's not a good idea. So instead, we request that if there's a family member coming with you, we request it only be one. We screen them as well. Have you been anywhere around anybody that's possibly been off island in the last 14 days? Are you experiencing a cough, cold, sore throat, any of those respiratory symptoms? We ask all those questions to those people as well. And in general, the public gets it. They understand. They're not pushing back on that. More often than not, what we're seeing is they're just dropping their family member at the door. They're staying in their car and waiting until they need to pick up their
Very good, very good to hear. Well, Melissa, thank you for checking in. I know you guys got a lot of stuff to do to just kind of prepare for this order, so we really appreciate it. And any thing you need to get us out or you need us to get out, don't hesitate to call, okay?
All right, I certainly will. Thank you all so much for what you're doing to help spread the good word out there.
Thank you very much.
Also for what you're doing.
All right, 7:15. That's Melissa Weibel, Island Cancer Center. Hey, let's go over this order again. It goes into effect at noon. Executive Order